Hello, good evening, everyone. So, I am Dr. Pramod Pareek. I am Associate Professor in Cardiology at Jailan Medical College, Ajmer. And today we are going to discuss about pedal edema. What are the different causes for that? Important causes may be the CKD. What are the reasons? What are their symptoms? And what is the treatment? So, pedal edema and chronic kidney disease for this session, uh, I am welcoming to all of you. And today we will know that what is the pedal edema, what is the reason for that, and how does it correlate with CKD, and how to treat them. So, what is pedal edema? So, pedal edema is a condition in which there is a swelling below the knee part. And why this swelling happens? Because the fluid part or liquid part is accumulated subinterstitially below the knee, and because of that, we feel that our limbs are swollen and edematous. So it may be because of many reasons, like problem of heart, problem of liver, problem of thyroid, problem of kidney, and also due to the anemia, lack of loss of hemoglobin. So our liquid system in body is divided into particularly two parts. One part is present inside the cell, one is the outside the cell. So outside the cell is extracellular fluid. Once the extracellular fluid increases in amount, that causes the pedal beam. And problem happens once in blood vessels, there is so much of pressure generated because of heart failure, because of CKD. The extra fluid of body doesn't get extravasated from the body. So fluid and sodium continuously accumulated in our body, and because of that, blood this fluid part accumulated in extracellular space and leads to edema. So, what are the role of kidney to manage all these conditions? Kidney is a important organ that manage the fluid and electrolytes homeostasis of our body. Kidney control if the extra fluid is in the body. Kidney remove that fluid from the body by the process of diuresis. So once that there is dysfunctioning of kidney in form of CKD or in form of any acute renal damage, patient can lost his ability to manage this extra fluid in body, and this fluid accumulated in particularly in dependent part of our body, that leads to the edema. So how how we manage or how we will approach to a patient of edema? So what we will think? We have to take 3 or 4 points in our mind. First is this edema is present on whole of our body? Okay. So if it is present whole of our body, then it may be related to the systemic disorder. It may be because of heart failure or because of kidney failure. If it is presented in a localized portion of the body, in particular space, then it may be because of some lymphatic drainage failure of that particular part. So how second part to approach a patient of edema, that if it is edema is pitting or non-pitting. Pitting means if we press 2 or 3 finger in the lower part in the leg of a person against the shin of tibia, if the pit remains for more than 20 seconds, means the pitting edema is there. If it is pit doesn't form, it means non-pitting edema. So there are certain different causes for the pitting edema, certain different causes for non-pitting edema. So third part to process, first we look just in summary. First we look it is the generalized or localized edema. Second is it pitting edema or non-pitting edema? And third part are the investigation. So we have to advise investigation for a particular person once we see a patient with edema because of kidney disease, because of heart disease, or because of thyroid, because of anemia. So we have to advise investigation accordingly. So what the investigation particularly will be help to diagnose a patient of edema. So first is the hemoglobin. If hemoglobin is less, there is anemia, it may be the cause of that particular edema. Another, to check the ability of kidney function, we have to order urea and creatinine. These are the basic tests which show the renal functioning. And if it is disturbance in the urea creatinine, we can easily diagnose that this edema is because of kidney dysfunction. Third one is that among the liver function, we have to order total protein and Ag ratio. With the chronic liver disease, there will be less of albumin in the body. And because of that, patient can develop edema. Third one is urine analysis. If there is the microalbumin or albumin present in the urine, means the albumin is body is losing albumin through the urine, and it is also important component of kidney dysfunction. And because of that, patient can develop hypoalbuminemia, and patient can develop edema. Okay, so another investigation which can be helpful for us is the ultrasound, 2D echo, ECG, 2D echo particularly for functioning of heart, thyroid profile. So these are the some other causes which can help that edema is what is the cause of edema. Another, we can go for local investigation like color Doppler for a particular sometime that there is venous obstruction. If all the investigation basic are normal, we can go for venogram. There may be some obstruction of inferior vena cava which can lead to the long-term blood stasis in lower limbs. There may be varicose vein. These are also another causes for edema. So what are the treatment? So immediate treatment, edema in particularly lower limb is the dependent part, and the gravity plays an important role. So we tell the patient to avoid tangling down the lower limbs. So patient can put his or her legs while sitting on a chair. Then he or she should be used some another chair to put the both lower limb on that chair. So by doing this, we can avoid the role of gravity to develop the edema part. Next, we can use compressive stockings, particularly in patient edema with local venous obstruction or local valve incompetency, particularly in varicose vein. We can use compression stocking, particularly during the active work of that patient. So patient can benefit it to get extra accumulation of fluid in particularly lower part. Physiotherapy and ice use of ice. This is ice is sometime in acute inflammatory condition. We can use these ice. Third one, we have to treat specific causes. If anemia is there, if it is severe anemia, we can do blood transfusion. Cause of anemia is most of the time iron deficiency. We can give the iron therapy, folic acid therapy, vitamin B12 therapy. If heart failure is there, we can restrict the fluid for the patient. We can give the diuretics. By doing so, we can remove this edema. Particularly in CKD patients, initially we can use high dose of diuretics. If it is not functional or it is not treatable with diuretic, we can go for dialysis also. So edema, treatment of edema depends on what is the cause of edema. So I just mentioned common causes. Like another, if it is because of hypoalbuminemia, particularly with liver disease, we can transfuse the blood, transfuse the albumin to the patient. So the oncotic pressure can be maintained and there is no extravasation of fluid in extracellular space. What the eating habit should be there? Patient is advised to take less fluid intake, less water intake. So no extra fluid, no extra accumulations. So by doing this, we can prevent or we can control the edema. And lastly, if system is specific, particularly what system is affected, either it's kidney, liver, heart, we have to treat the patient accordingly. So the initial management for any type of edema is the fluid and sodium restrictions. Because sodium is a very important component, electrolyte, which try to accumulate fluid in our body excessively. So by doing so, there will be the excess fluid in the body. So we have to restrict the fluid, we have to restrict the sodium. After that, we can use the diuretics, particularly by increase amount of urine, we can decrease the total body fluid. Third one, we have to go for specific treatment, particularly according to the which organ is affected. Once that we will already discuss in management and approach part. If we feel it is kidney, treat accordingly. It is heart, treat accordingly. It is liver, treat accordingly. It is anemia, thyroid, we can treat accordingly. So we have to make understand patient that this is your problem. Apart from medicine, you have to take certain lifestyle modifications in form of your dietary habits, your fluid intake habits, how you sit, how you wear the cloth, stockings. So patient's lifestyle modification also will help to treatment the edema. So there is to increase awareness. Sometimes edema is the very initial symptom of very big diseases like kidney diseases. Patient doesn't feel any other symptoms. He or she just know there is swelling in the lower limbs. And then the investigation advised and patient found that it is a patient of CKD or it is a patient of liver disease, it is a patient of heart disease. So edema is a very important sign which should be kept in mind for patient, and for that also there is a to increase the awareness about this edema, there is a 25th September, there is National Edema Day, National Edema Awareness Day. By that, we can just propagate the knowledge about this important sign, important symptom sign. This is a sign or symptom. Sometimes if it's the large amount of fluid accumulate can be present as a symptom also. So we can make aware to the person and people that they should don't take it lightly. Just go and check up by physician and their edema. It may be either because of simple tangling down of more time to tangling down of feet downward, or some systemic involvement or some local involvement or some metabolic involvement.